Okay, so again, welcome. Thank you so much for joining me tonight. We're going to be discussing the school list and how to put that together. So tonight we'll focus on these different areas as ways of thinking about how to put together your school list. We'll talk about location, the school metrics, how to figure out what your best fit institution is in regards to metrics. We'll also go over some school specifics and things that you should keep in mind and give a couple of examples of those school specifics. We'll also talk about some student perspectives that we've gathered over the years of things that students have kept in mind as they've been putting together their school list or things that they have learned from putting together their school list. I will also talk about mission and values and how to determine your best fit based on your experiences and the mission and values of the schools that you may be thinking of applying to. Okay, so in thinking about location, you want to think about what's the population that you want to serve. Are you interested in underserved populations, more of rural medicine? Are you interested in certain types of ailments that may be prevalent in certain areas? Are you interested in those and how they serve? Whether that be from a community health aspect, thinking about patient focus and patient center. You also want to think about your support system. So medical school is a long endeavor and it also can be emotionally taxing. So you want to think about, are you close to your family and friends? Are you so close to your support network that's really going to be able to give you what you need emotionally and also a bit of a reprieve sometimes from your studies. Is how important is that to you in terms of being close to them? What activities do you enjoy most? Like, where do you want to live? If you are a person who really likes theater, you want to make sure that that is something that the city that you are living in has. Are you really into different types of food, multicultural, things like that? You want that to be part of your experience. So, thinking about the activities that you really enjoy and making sure that the cities that you are thinking about applying to programs in, will really be able to support the type of living that you want to do over your time in medical school. Um, is weather a factor? Are you looking for somewhere that has all four seasons? Are you looking for a place that you want to try out a new type of living environment? So just keeping those types of things in mind. If you're really not a person who can deal with the cold, then probably going somewhere where it doesn't get very warm is probably not the most ideal. So you want to think about what your living conditions are going to look like. And also just keeping in mind of being open to a new way of living, being open to new cities and what they might have to offer, I think can help you to expand on places that you might want to apply to. Thinking about the type of transportation, are you a person that drives or is willing to learn how to drive if you don't? Because there are certain areas of the country that are not accessible by public transportation. So keeping that in mind as well, are you going to be traveling back and forth to your classroom, to your clinical sites, things of that nature? Also thinking about political ideologies, if that's important to you, what can doctors do and not do in certain areas, and how that will affect your practice as well in your education. So also thinking about what will your peers be like? What is the student population like? We'll mention and talk about like size of programs and things of that nature as well, because that can be an important factor. Thinking about the support services you need. So, some institutions provide a lot of like academic support services, small group modeling, for academic support, as well as support of different identities. So is there a diversity, equity, and inclusion office? How do they serve their students? Is that something that's important to you? Thinking about how you learn best and the type of curriculum, and we'll talk about that a little bit later as well. Give you some examples of the different types of curriculum that exist and that you may want to take into consideration. Also thinking about the issues that are important to you and how you would like to see this reflected in the programs that you're thinking of applying to. So thinking back again to maybe social determinants of health are really important to you. So you want to be part of a school that really focuses on those, on also thinking about those things as well as advocacy. And then thinking about the career paths and how that's reflected in the graduates and where you see yourself. Are there certain residencies that you're more interested in? And so those schools that have a better match to those residencies is maybe more appealing to you. Okay, cool. Just admit everyone there. Okay, so the other thing to keep in mind, of course, are thinking about the metrics. The medical school admissions requirements, the MSAR, provides a pretty broad overview of the metrics for admission for each institution. And if you go through the MSAR, you can gain a lot of information about how much research most people have done, the average age of the incoming class, median MCAT, 10th percentile, the lower 10th percentile, the higher 10th percentile, and really be able to find schools that have a match between your GPA and MCAT. I think a good rule of thumb in thinking about where your MCAT falls with different institutions and if you're in that target range is thinking about plus or minus 3 points. So if you're applying to a school where the median MCAT is a 515, you're still within range plus or minus 3 points. I think anything outside of that, you can certainly have a conversation of course with a pre-health advisor or with representatives from the school. But I think at that point, it becomes a case by case in terms of other factors that may be a good fit for those schools. But you don't want to overwhelm your list with reach schools. So for an example, if you have a list of 20 schools, it's suggested that no more than two or three of those schools be you be well outside of the median range, so more than those 3 points in the median. I mean, what we're gonna do now is just take a second, and I'm gonna stop sharing my screen for a second, and we'll move over to just look through the MSAR so that you can get a sense of what that looks like if you haven't, or if you've looked at it and you're not sure exactly what you're reading. We can take a look at that together. We'll use University of Maryland as our school. So this is just a screenshot of the MSAR, but we'll go over to it so that you can see exactly what we're talking about. Okay, so just bear with me for 1 second. Okay. Okay, so you all should see this now. And we had a few more people join us. We'll just let them in. Okay, so you all should be able to see this now. And this is what the MSAR looks like. So we can go back to what you'll see when you first come into the MSAR. I just searched for University of Maryland as our example. So you'll see here that you have the location, and you can search by state here. And you can select which states, territories, and parts of Canada that you are interested in schools in that location if you want to start with that. You can also search by median, and you can filter rather by median MCAT and also GPA. And then there are other filter options here: public versus private, class size, campus type, um, to help narrow down your search. But if you're doing a broader search, let's just say that we want to take a look at Maryland. So you can type in the specific schools that you're interested in here, and we can click on that, and that will bring up Maryland for us. Okay, so one thing that I do want to bring up that can be a little bit misleading from all of the medical schools really is this application deadline date. So you'll notice that the application deadlines are typically in the fall or in the winter, but a lot of the application review and interview invites happen over the summer. So really, we recommend that you adhere to the proposed timeline that we give to you. And I think in talking to medical school admissions representatives as well, you'll hear more and more that you should be applying early, submitting that application in June, and your secondaries over the summer, because interview invites can go out as early as August. So you don't want to be waiting until November 1st, although they will accept your secondaries until November 1st. You really want to be getting that done in the summer. So that's just something that I wanted to make sure that we mentioned and that you are aware of. So as you can see here, broadly, you can see the median MCAT, you can see the median GPA here, the tuition and fees. You can also see the demographics of the class, that it's a public institution, which means that although they accept out-of-state Canadian and international students on a case-by-case basis, you'll see a little bit later kind of the difference between the interviews that are given for in-state versus out-of-state and other students. So as you go through, they'll give you more basic information about the school. They'll also tell you about the different programs that they offer. So if you're interested in any of like the dual degree programs, this is also a great way to figure out if the schools that you're interested have dual degree programs like an MD MPH program or MD MBA program, things like that that you might be interested in. You'll also be able to find their mission statement on here, and we'll talk about mission statements a little bit more and why that's important in determining your fit. You'll also see the application services they use. Most places are going to use AMCAS. The MD programs are going to use AMCAS. That's the American Medical College Application Service for all the MD programs outside of Texas. Texas has its own application service. So you'll also see here how they accept letters of recommendation, what they ask for. You'll see here that they prefer a committee letter. And so that means that our committee letter that we provide really takes the place of any of the individual letters that that you might see stated or required. So they will default to what we ask for in our committee process. They also tell you more about later communication with them. They also supply you with the secondary fee, what that looks like, if they have fee waivers available when they send their secondary application. So here you can tell that all applicants with a verified AMCAS will receive a secondary application. So that means that if you list them on your verified, on your AMCAS application, once it is verified, you will receive a secondary. So then they go on to give you some more information about their interview process, things like that. Preliminary interview information, how many people were interviewed in state, how many people were interviewed out of state, international, total number of interviews. They also give you more information about what their interview day looks like. They also tell you a little bit more about like the MCAT information. They'll also tell you about coursework that's required. So this is really a comprehensive place to find out a lot of information about particular schools. So we're just going to jump down here, if this will let us, to the acceptance data. So here is where you can find out, like, see these different percentiles that we were talking about. So this lower percentile means that they did accept applicants that were in this lower 10th percentile, and also those in the higher 10th percentile. This was their median. So most people came in right around this area. So that's that plus or minus really 3 points in their MCAT. So you can also see here, you can explore the data through filters. So you can see data for all accepted in-state students as opposed to all applicants. And so you can see how that might shift for in-state students. If you're an out-of-state student to this particular institution, you can see how that might shift in numbers for out-of-state students as well. You can also look at students that actually decided to matriculate and what that looks like data-wise. And you can really play around with this. You can enter your own MCAT score, see where you fare. You can also see the breakdown of the section of scores and where everyone where they fell in the 10th percentiles, the median and the higher 10th percentile. And then you'll see the breakdown here as well. So same thing happens for GPA. You can use the same filters here as well. So this can be really helpful in thinking about where you are, what your metrics look like, and really being able to put together that school list. So that's what the MSAR looks like. If you are applying this year and you have not purchased a subscription to the MSAR, I highly recommend that you do, so that you can have access to this data as you are building your school list. And this is really like the preliminary end of it, because you'll also want to think about, the overall fit of the institution, but this can at least help you to start to narrow down certain institutions and take a look at their metrics. Okay, so I think we should be able to just jump back here. Can you all still see my screen? You can just go ahead and throw a thumbs up if you can. Think you should still be able to. Okay. So the next thing that we're going to talk about are some of the school specifics. So once you get past the metrics, you're going to think about what are the things that I really want out of my medical school education. So thinking about the teaching styles, what does that look like? Is it lecture-based? Is it problem-based learning? Is it hybrid? What's the class size? So there are some classes that are very small, around 50 students, and then there are some class sizes that are much larger, where you may have around 300 students. So those experiences can be a little bit different, and neither is better than the other, but one might be better than the other for you in particular. So grading method, is it a pass-fail system? High honors, honors pass? What are their residency match rates, different identities that are supported on campus, and different programs that are also available. So we thought it'd be helpful to give an example of what this problem-based learning looks like, because we often get that question of like, what is problem-based learning? And you can find these right on the school's websites as well. But we thought it would be helpful to just talk about what this might look like and how this might be a factor in you making your decision. So you could see here at Case Western that students have a level of independence to develop their own learning objectives. And there are 2 cases that you work on Mondays, and then return them on Wednesdays, and then on Friday you discuss the reading. So these are small learning groups that you work with. And there really is a level of independence in learning before you get to your small groups, but it's heavily discussion based once you are in your small groups. You could see that Thomas Jefferson also takes a similar approach, and they tell you the size of the groups that you'll be working with, about 9 to 10 students, and a faculty facilitator that meets twice a week. And they also do mix up the groups. So you'll have 12 weeks of working with the same people, and then you'll get a change and be able to work with new people. So that might be something that is of interest to you as well. So understanding mission and values is also really helpful in thinking about what schools you're interested in. We have a number of different ways of going about that. Virtual admissions presentations. I will share with you if you are don't already know about our the Office of Pre-Professional Advising, our YouTube page, which has the recordings of all of the admissions presentations that we've had over the year. There are also a number of different podcasts that you can listen to, but the All Access podcast is really helpful in interviewing different school officials and getting their take on what their admissions process looks like and what their program is like. So this is just a screenshot of the YouTube page, and I'll share that with you, the actual link in the chat at the end of our workshop, which will be happening in just a few minutes. We won't take up too much more of your time. But this here, you could see that we've had quite a few school presentations. And so you can go on there, listen to them at your own speed, listen to them on your own time, and be able to hear from the different school representatives. And we've also taken this list, the people that we ask to come and do the admissions presentation, we do take from Hopkins students list of schools. So the most schools that we see Hopkins students applying to. So we really do try to make the presentations relevant to the interest of Hopkins students. Okay, so let's just take a look at some of these sample mission statements. And I think that in the mission statement, although a lot of them have similar words, you can start to pick out a bit of what they're really interested in, right? So here, if you're looking at Johns Hopkins Medical School, you can see that, yes, there's an interest in research, but specifically they're mentioning biomedical research. So if you are really interested in that, you have experience in biomedical research, prior to this, that might be one of the reasons why it's a good fit for you. Also, they are seeking to train healthcare professionals that really provide a patient-centered medicine, and are looking at preventative diagnosis and treatment of human illnesses. So that patient-centered also can give you an idea of the importance of your clinical experiences and being able to highlight those in your secondaries to Hopkins. And then there is also at Hopkins, there is also, you can see from some of the work that they do, that there's also a focus in being innovative and creative ways of approaching medicine as well. So if we look here at Wayne State, we can pick out some of the words here that maybe you can find things from your experiences or of your interests that can help you to really show Wayne State that this would be, a good fit institution for you. So urban setting, that can give you a clue to what type of population that they work with and that they serve. And if you are also interested in working with an urban population and you have in the past, you could definitely talk about that fit there. Also in thinking about pioneering research, so they don't specifically have here, what type of research. So I definitely think that going a little bit further into looking at what some of their research options are, could be helpful if you're thinking about, like, I want research to be part of my medical school education, but I'm not exactly sure what and how that's gonna look like. You can definitely go onto their site to see a little bit more about what they're doing research in, but pioneering research, I think you can also think about being innovative, proposing new ideas, and it being a place where that is welcome. Thinking about local investment in the community, that's a huge piece, right? So they're interested in those who are going to serve the community and who have done so in the past. So that would be an opportunity for you to be able to demonstrate the service that you've provided to the Baltimore community, to the Hopkins community and the Baltimore surrounding community. So at Loma Linda, it has a focus in Christian values. So if you are religious and you have a religious focus, or you want to serve under that model, then this would be a good place for you to apply. If you're not interested in that, and you're not a very religious person or want to follow those types of ideals, then Loma Linda would not be a good place for you to apply, regardless of whether or not you meet you're kind of in the match for the metrics there. So we often get the question of how many schools do I apply to? So nationally, applicants apply to about 17 schools. At Hopkins, we see about average between 20 to 25 schools. And you really should keep in mind the cost. And we'll give you like a synopsis of what the cost can look like and how much time you actually have for secondaries. Often we have conversations with people who are in the middle of their application cycle and writing secondaries, and they've really overestimated the amount of time that it takes and the amount of time that they have. And so then they enter into um, I think a space where you don't want to be, where you're picking and choosing schools that you are completing the secondaries for based on length or the time that you have to actually fill it out. So just being strategic and thinking about being realistic about that time, I think is important. So costs associated. The average application, this is inclusive for about 20 schools, it can be estimated around $1,100. So this is, we understand, an expensive process. And so that's why we really want you to take the time to do the research for the schools that you want to apply to, so that you are maximizing your opportunities. If you feel like you might qualify for the double AMC fee assistance program, please apply, and please apply early. Some of the benefits of applying to the fee assistance program is a reduced registration fee for the MCAT. It is not retroactive, so if you do apply for fee assistance, but you've already taken the MCAT, they're not going to refund you for anything. So it's better to just do it ahead of time. You also get a 2-year subscription to MSAR, so that system that we just went through where we looked at the University of Maryland. You also get a waiver for all AMCAS fees for one submission that covers up to 20 medical schools. So it would save you that estimated $1,100. And you also get a waiver for the double AMC preview. The preview is one of the situational judgment tests that some schools may require that you take. The other one is Casper. So when you're looking at your school selection, they may have these tests associated with them, and they are situational judgment tests. You can learn more about how they're conducted, the format for them, and maybe some strategies for thinking about the questions, but there really isn't any content to be learned the same way as the MCAT, because it really is there to test or to get a sense of what kind of judgment you have and what judgment calls you would make in different scenarios. So we also have here, and you can find this right on the double AMC website. You can also find this link to the double AMC on our website, are the top 10 questions that pre-meds should ask medical school financial aid officers once you are actually um, you receive an offer to a school, and then you are having conversations about financial aid. I mean, these questions can also be asked prior to receiving an offer as well. When you're in information sessions and you have the opportunity to ask questions, you will want to talk about associated costs. Okay, so some tools that we find helpful. Of course, the MSAR, because it gives you all of that information, but you can also create your list using the MSAR. They do give you the opportunity to be able to save your list, and be able to put that together. Prospective Doctor also has helpful information on there, and they also have information about the different secondaries that each school has from previous years. And secondaries don't change that much from year to year, although they are subject to change, but it can give you an idea of what each school is going to ask and what they care about. There's also the All Access Med Admissions podcast, which we really find helpful if you are a podcast person. You can listen to the different schools talk about their programs and their admissions processes, and I think that that can be helpful. We do not recommend using US News. Quite a few schools have pulled out actually of the ranking system because they do not feel like it is beneficial for their programs because they're looking for their best fit students, and they also do not feel that the rankings are representative of their programs, and it's quite a few of what would be considered in the past top ranking schools that have pulled out of this. So US News is not really helpful in that respect, but these other tools can be helpful in putting together this list. So some things that we've gotten from applicants, their perspectives and let's go back one. Okay, so their perspectives and some of their tips. So how do they keep track of their schools? Many applicants use a spreadsheet that they keep different tabs that are important to them, mainly metrics, unique programs that the school may have. If they have, like, if you're interested in emergency medicine and they have EMT certification, that might be something that you want to put on that's important to your list. If they start clinicals earlier than other schools, and that's really important to you, that might be something that you put on there. If you're interested in global health programs or types of research or grading systems, class size, all of the different things that are you're considering and are important to you certainly can go on that list. And then also the MSAR can be used to create and save school lists. So we asked them what were some of the things that were important to you when you developed your school list. They thought about extracurriculars, right? Like you're still a whole student, things that you've done now at Hopkins, you may want to continue in medical school. So do you have the opportunity to do that? Is it available? And if it's not available, are there opportunities to be able to create that? Example, if you're, an avid runner, is there a run club? And if not, can you create one there? Or it may be, a part of the city. Thinking about locations, things to do. We talked about that a bit. Student and family housing options. Many people going to medical school are have families. They might be married. They might have children. They could be single. Thinking about what your housing options are important. Your support network, we talked a bit about that in the beginning, thinking about the curriculum. So, like, is it problem-based learning? How long are you in your, what's the approach to learning? Like, is it systems-based? Is that how you're going to go about it? Or is it case-based? Is it really encouraging student collaboration? Is that important to you? Thinking about that academic and social support as well that we talked about, the patient population, community involvement. So all of these things were factors that other Hopkins applicants have considered in the past. So then thinking about, we asked them to think about their experience and any advice that they might have for putting together the school list. And these were kind of the top pieces of advice. So being realistic about your secondaries and writing fatigue over the summer. Writing you can do a bit of pre-writing, and I think you can be strategic about how you approach your secondaries. And I think it's important to think about that. You can reach a level of writer's fatigue over July and August. If you wait until then to begin writing the secondary. So as much pre-writing as you can do, I think in June is helpful. Be open to explore a variety of medical programs. Many programs that you may not have heard of may have a lot of things that excite you about medical school. And so just being open to new cities, areas, exploring them and not discounting them before you've gotten to know them, it can be helpful. And a lot of ways to learn about those types of schools are to attend and watch information sessions. So as many of those as you can attend, I think can be helpful. And making sure you apply to your state institutions if that applies to you. So your state institutions essentially are some of your better opportunities for being admitted because state schools, so public institutions for that state, have they receive funding for training medical professionals that are going to serve the state community. And a lot of the thought process of that is that if you're from that area, applying to your state institution, you'll also be one to serve that area as well in the future. Okay, so now we are at the questions portion. Hopefully, this information was helpful in getting you started to think about or refine your list if you already put that together. Again, I will answer the questions if there are any in the chat, and I will answer them out loud. So if you do have personal questions, we do have the pre-professional email here that you can utilize to send your questions there. So I'm going to stop sharing my screen now, and I'll open up the chat. Okay, so one of the questions is, do you recommend getting the MSAR subscription if you don't plan on applying until next cycle? Is it useful before you actually apply? I think that it can be useful in just understanding better what some medical schools are looking for, and that can help to guide maybe some activities that you might want to be part of prior to um prior to your application. And so I think it could be helpful. The MSAR subscription does last for 2 years. So if you do purchase it, it will still be valuable during your application year. And I think that if you are planning on taking the MCAT and you qualify for the fee assistance, that'll come along with it as well. So there's also a question about receiving secondaries but not completing them. Um, It's not necessarily that there's a downside to that. However, I think that if you are going to spend the money to get the secondary, I mean, it's not necessarily like a downside to the school, but I think financially, those are some things that you might want to avoid. I think that you want to I think that for the schools that you are applying to and submitting your application, you want to submit those secondaries. But if you end up not doing anything, they just don't move forward with your application. So it's not anything that they do or are able to or send you any information about. It's just at that point considered a passive withdrawal and that you're no longer interested in their institution. So the follow-up question tonight is the average number of secondaries. That goes back to the average number of schools because the schools are associated with the secondary. So you don't get any secondaries from schools that you haven't listed on your AMCAS application. So average between 20 and 25. So one of the questions, can we know the top 10 schools Hopkins students applied to and accepted? Yes, actually, we're working on our social media campaign for May, and that will be included. So that will be to come, and you will be able to see that. And then should we apply to our state schools even if the metrics are plus or minus 3 points of that score? That's a great question. And yes, you should apply to your state institution. So one of the questions is about early decision process. And unless you have had really like prior conversations with that institution and you've talked about applying early decision, you should apply regular admissions because early decision essentially um it bars you from being able to apply to any other medical schools until you receive that decision of yes or no. And I've had some applicants who have done an early decision and then were not accepted, and then their application becomes later for other institutions that they wanted to apply to. So unless you're absolutely sure and have been in conversation with the admissions office, I don't recommend applying early decision to any school. Okay, so what's the social media handle? Okay, so I'm just gonna go ahead and drop our website in the chat. because that has all of our social media on there. You'll be able to find all of the links that we have as well. And so I think that that will be helpful. The links to the social media are right on the first page. So it's right at the bottom. You can't miss it. And I will give that to you in just a second. Okay, here's that page. And then also the link to the YouTube so that you can look at those medical school presentations as well. Any other questions? So it was a question about how you should look at public schools if they're out of state. So that admissions data, I think on MSAR is pretty helpful because it will show you the number of applicants that they've had from out of state applicants, how many interviews that they've given, and they'll give that in relation to how many in-state applicants and in-state interviews. And then you can also filter by admissions data for out-of-state students. And so if you're looking at a school where they really have you're seeing maybe thousands of applications. Let's just go with 1,000 applications from out-of-state students, and they've given interviews to 100, and they receive 1,000 applications from their in-state students, and they are giving out 400 interviews to their in-state students. That can kind of tell you that that particular institution really does sway to their in-state students. There will be some schools like Michigan where you might see more of a 50-50 balance. And so you can see that those public institutions might be a little bit more open and friendly to out-of-state students. Question about if mentioning a specific area or specialty in a personal statement is limiting for medical schools that may not primarily serve that population. I don't think so. I think it's in the way that you talk about it. You could talk about how you've learned from them, um, as opposed to this is the only area that you're interested in and you're not open to exploring other areas. So I think that it's absolutely fine to think about how your background has influenced you and your decision, but that doesn't mean that that's the only area of interest. So there was a question about Texas schools and a strong in-state bias. That is correct. Texas is it's really, really difficult to get into a Texas school, public school, if you're not a Texas resident. And Texas also has their own match process for medical school. So I think if you have a really, really strong fit for one of their institutions, you might be able to make the case, but I do think that Texas is um, particularly interested in their own state residents, at least their public institutions. So does the MCAT score difference of like 4 or 5 points make the school beyond reach? Not necessarily. Like you can look at the 10th percentile. I just don't think that your school list should be oversaturated with those schools. So if you're 4 or 5 points below the median, but you're still in the 10th percentile and you have a strong fit otherwise for that institution, you should still apply there. I just don't think that you should have 10 of your 20 schools be fit that criteria. Okay, so if you've taken the MCAT multiple times, Typically, the schools are, although they can see both of your scores, they're typically going to go with the higher score. So I think that utilizing the higher score as part of your as part of looking at the MSAR and looking at your best fit is the better option. If you're not a resident of the state, but you have like a strong support system there, again, that's something that would mean that the school would be a good fit for you. And so, yes, that might be one of the schools on your list. But again, you just don't want to oversaturate your list with that. But yes, you can absolutely talk about your familial support in that area and why that would be a school of interest for you. So the Texas system does have its own application process, but it is similar to AMCAS. It asks all the same questions. It asks for all of the same supplemental documents. So your letters of recommendation, committee letter, if you're receiving that, as well as your transcripts. It's just submitting it to the to TMD SAS, which is the Texas system, as well as AMCAS. And then they go through an internal match process. So when you interview at the Texas schools, you rank them according to what your preference is, and they rank you. And that's how the match process works. So, how do schools determine residency if you live in Maryland, but are from a different state? Do you need to move back to the state to regain residency? That is dependent on the state. So each in the institution actually. So each school, or each system has its own criteria for what they consider you to be a resident. So for somewhere like Maryland, yes, if you've graduated from Hopkins, you're living in Maryland, they'll consider you for in-state, and quite a few states are like that. Massachusetts, not so much. That you have to have been there prior to school, or have your parents have an address there. California, you have to have gone to high school there, your parents be a resident there. There's different criteria. So you should definitely check the school's website on what they consider to be a resident, because each school is allowed to have their own criteria. Well, I should say, each state, like public institution, they typically share the criteria, but each state is allowed to have their own. So another question is about tuition in-state and out-of-state. Yes, public institutions do have in-state and out-of-state option tuition, like in undergrad, and you can find that information on the MSAR. And yes, it also does pertain to admission as well. So they're just more likely to give, and again, you could see like this data and how much more likely certain schools are to give interviews to their in-state um their residents versus non-residents. We have about 5 more minutes, so I'll be on for about 5 more minutes. So if anyone has questions or you think of anything in that time period, please feel free to add if you are or and also please feel free to sign off if you feel like you've had all of your questions answered. Again, thank you so much for joining me tonight. You're welcome. I'm glad you found it helpful. You're
Thank you.
welcome. Glad that it was of help. You're welcome. So you have to meet the residency requirements prior to matriculation. You're welcome.